back, and the chair now recognizes the chair of the full committee, Chair Rodgers, for 5 minutes for an opening statement.
Thank you, Mr. Chairman. And I, too, would like to welcome my two daughters, two most important advisors, Bryn Rodgers and Grace Rodgers, who are on spring break. It's great to have them in D.C. today. Yes, so welcome to the Energy and Commerce Committee. Yeah, it's great to have you. And also welcome to Carol Johnson, the administrator for the Health Resources and Services Administration, known as HRSA. And I too want to say thanks for the detailed district analysis that you've given each one of us, and also coming to Spokane and spending some time in my district. Today we will discuss several existing federal programs and proposed legislation related to healthcare workforce, primary care services, Oregon procurement competition, countermeasure injury compensation transparency, and diabetes research and treatment. The healthcare workforce shortage is leaving people without the primary care they need, which is why we're considering the Strengthening Community Care Act of 2023, led by Representative Joyce. This legislation will reauthorize the Community Health Center Fund and the National Health Services Corps that will help support both primary care services and the healthcare workforce. I am especially proud of the work community health centers in my district are doing to expand services and increase job opportunities. New Health currently offers a medical assistant pre-apprenticeship program in partnership with local high schools. They are also working with a local school district to develop workforce training center where rural high school students can gain access to clinical and non-clinical internships. Additionally, Chaz Health in Spokane is giving high school students the opportunity to participate in training sessions where they can learn about the different aspects of the health clinic and related professions. I'm hopeful that these efforts will help bring more healthcare workers into our community. Next, we'll discuss proposals to continue the Teaching Health Center Graduate Medical Education Program funding. I'm a longtime supporter of this program, which helps to bring more primary care doctors, OBGYNs, mental health providers, and others to rural areas. Spokane, Washington has recognized this and is a national leader on recruiting the next generation of healthcare workers. The mandatory funding for this program runs out September 30th, and I am committed to working to extend it. I hope that we can come to a bipartisan agreement and find the offsets needed. We will also consider the National Nursing Workforce Center Act of 2023, led by Representative Young Kim. This bill will help enhance existing state-based nursing workforce centers so that we can better access workforce challenges and address any gaps. I'm thankful for Representative Bouchon's leadership on the securing of the U.S. Oregon Procurement and Transplantation Network Act. It will allow for HRSA to make the Oregon Procurement and Transplantation Network process more competitive, with the ultimate goal of making organs available to more people in need. One area where more work needs to be done. We will also consider a proposal to increase transparency within the Countermeasures Injury Compensation Program. This is administered by HRSA and provides compensation for covered injuries or deaths that occur as a direct result of using certain countermeasures used to treat ailments from a public health emergency or security threat. Lastly, we will discuss two programs critical to improve the lives of people with diabetes, including Representative Bilirakis' Special Diabetes Program Reauthorization Act of 2023 and Representative Cole's Special Diabetes Program for Indians Reauthorization Act of 2023. With that, I'm looking forward to today's discussion, and I yield back.
The gentlelady, the chair yields back.